I had my training at the Long Island Jewish Hospital in New York. It's the biggest speech and hearing center in Long Island. I was a resident in ENT in ear, nose, and throat. Audiology Speech and Hearing Center, that's where audiological examination, hearing aid dispensing, and others have done. To my surprise, I've not seen this kind of setup in Manila. That was the 70s. Because I know, when I say so, after my graduation, I went around, say, Biluna, is a military hospital, the big constabulary hospital, UST, my alma mater. The ENT department doesn't have this, just simple tests, or maybe it's more of surgical diagnostic approach. I even went to another university and of course PGH. I was looking at the facility, where can I send my patient? Comparable to what I was trained when I get, audiological examination to help me in the management and diagnosis of the patient. I was so disappointed because there was nothing. What I did, I borrowed some capital from my parents and bought the equipment similar to what I saw at the Long Island Jewish Hospital. Actually, it happens to be the first speech and hearing clinic in the Philippines with that caliber equipment. So the ENT community were surprised. Mayroon palang may mga equipments like dito sa Pilipinas, which they read only in the book. So we published a booklet informative of what we have, Manila Hearing Aid. Manila Hearing Aid, yun na hearing aid, but it was speech and hearing, more sophisticated and extensive ang coverage ng diagnostic. Very few has attained the level of what we have. It's because we were providing equipments. Yan ang ano. The problem here is acquisition of equipment, maintenance, at saka costing ng cost ng equipment. And we were helping out. That's one way to help the hearing impaired to solve their hearing problem. That's our mission. Will help, not the commercial aspect. Part ng ENT practice is audiology and otology. And that is my subspecialty, otology. You must learn, you must be passionate and more knowledge in audiology. Now, if you think about audiology now and hearing problem, you have to understand hearing aid. We started with Oticon is one of the oldest actually, 1903, so 120 years na yan. Advantage of the two, especially Oticon, it's a foundation, hindi commercial. So ang R&D nila, research and development, are the most advanced in this field. Ang purpose naman really to help the FDA regulation. Actually, you must help the amplification needs of the patient. That is diagnostic and maintenance. Yan ang hindi maaari yan, doktor. Ikaw doktor, gagamutin mo lang. Hindi. Human being, you have to take care. Walang ano-ano yan, walang pili-pili. That is what you call our mission, to help. So what we're training is this one now. We would like to train up to now. Actually, we help put up College of Audiology Master's Lab sa UST and UP. And we are proud to say, since na nilagay yan, they train with us. Kasi everybody's getting old. You cannot escape aging and hearing loss. Yung challenges was the commercial aspect of some temptation to, the commercialization of this. Well, we presented that this should be a professional, but the government should step in. So what I did, I presented to the US FDA, sundan you read something, you might do something about this, na gusto namin na there is that profession. O, hindi ka lang merchant na iinom, you want a professional, respetuhin ka. Serve the amplification needs of the patient. We will continue na we're always on the watchful development sa hearing aid technology and always comfortable level. That's technology. Sometimes our hearing aid is better than normal ear. We will keep on training na muna and availability of equipments that you don't have to spend much. The training, enough training that doesn't have to and then we keep on first simple technology. We train them and namin, ang dedication mo, you treat this one as a patient to help the amplification needs. So talagang kailangan nila. Wag lang yung pera na nakuha mo na. Yung sales talk, ayaw namin ng ganun. You should treat the patient like a patient, may handicap. The second generation now, tatlo ang audiologists sa family. Yung youngest ko, dalawa-dalawang degrees, Masters of Science in Audiology and Speech Pathology. Yung isa, Australian Diplomate in Audiology, Masters of Science in Audiology, dalawang Masters of Business Administration. Yung pangatlo ko has Diplomate in Audiology sa Australia, Masters of Science in Audiology Australia, and Doctor of Audiology, Doctor of Optometry, Doctor of Dentistry, Doctor of paramedical. Ano ba yung pride? That's something that we have to break. At saka secondly, I think we have to train anybody. Like yun sa ikaw ang pupunta sa pasyente, hindi yung pasyente pupunta sa iyo. Because matatanda yan eh. We have set up dreams with that. Kumbaga we want to expand further, help out. 5 to 10 years siguro, there will be more. Not necessarily yung physical appearance ng clinic ng Manila Hearing Aid. Maybe some kind of similar that, but a professional setting. We will keep on expanding. We will have to continue. Lumalaki ang population, lumalaki ang matanda, longer ang life, pihadong hard of hearing, and contributing to the long life and noise pollution. The first hearing aid center really that cares, that yung tunay na spirit ng, we call it in the broad term, hearing health provider, a real hearing health provider. Yun ang magandang na tawagin. Hindi dispenser, hearing health provider o the hearing health professional, tawagin ganun, na very professional. Talagang hearing aid talaga, ang pagkabingi ay hindi magagamot ng medicine, hindi magagamot ng surgery, amplification lang o electronic amplification lang. Yun ang treatment. Yun isang iniim namin na talagang serbisyo. Yun ang very important part yun eh. We are the biggest supplier of superior. Pero yun at sa tingin ko malaki na itulong namin. While in dedication sa trabaho, you work well the company and we'll give you everything. Parang mahusay ang team namin when it comes to that. You just cannot pick somebody from the sa kalsada na itatran mo dyan. Kaya they work hard to technology. Well, follow the very first mission ng company. Kaya second and third ito, bihira ang audiology, sayang. We started it, andyan na yan eh. Kaya kami mga doktor, ENT, yung nakakapasa yung paswerte na kung yung third generation eh. Ay, wala na akong masasabi eh. First, biro mo yun, nag-agree. Pumayag na mag-audiology yung tatlo. And that is concentrated to that business. Mahirap kumbinsan yung mga bata ganyan eh. Ang position namin is still number 1 sa sales, sa ito. So, they must be doing a good job. So, kunin na lang yan. Pero gusto namin i-spread it out. I can say, please do a good job. We just have to continue our mission and God will take care of us.